Hi, it's Dr. Sweeney here today to talk about PTSD. Now, PTSD stands for post-traumatic stress disorder. Now, this happens usually if people have obviously been through severe trauma, previously, thought of as something called shell shock in soldiers in the First World War, more latterly recognised as post-traumatic stress disorder in more modern times. This can happen after events which can be extremely stressful. So, for example, people that have been through wars, but also terrorist attacks, or just simply traumatic events that you experience in your day-to-day life, the unexpected loss of a loved one or a close friend or relative, any kind of accident that people have been in. Basically, anything that can cause severe acute stress and trauma can then have an ongoing ripple effect, which causes this syndrome of PTSD. Now, how do you know if you've got PTSD? Well, it can often follow a traumatic event. It can cause flashbacks, so all of a sudden you can have images and feelings in your mind taking you back to that particular event, which can occur at any point and trigger acute anxiety and panic. People can become quite depressed and withdrawn, and because of the trauma they've been through, they can also be very hypervigilant. So at times when normally you'd be able to sit and relax, people are very alert, often always thinking of where the next danger might come from. They just can't relax, can't switch off. It can affect sleep as well. Often people end up having to use other substances like alcohol or drugs to try and deal with the anxiety associated with this. And it can really affect people's lives. People can become very withdrawn and want to avoid situations. The bottom line is, if you have been through a traumatic event and it continues to have repercussions on your mental health, it's definitely worth speaking to a healthcare provider, perhaps then being referred on to a mental health specialist, psychiatrist, or a psychologist. The difference between them is that psychiatrists are often consultant doctors that are specially trained to deal with more severe mental health problems. Psychologists can also be Ph.D. doctors. They specialise in talking therapy in particular. And so talking therapy is a big mainstay of treating PTSD. Also, antidepressants, anti-anxiety tablets, medication is commonly used as well to help deal with these aspects of the illness. And it can take a long time to gradually get better and may never fully get better, but certainly there can be a lot done to help people cope with their mental health after traumatic events. It's very important that if you are suffering, particularly if you're feeling worse and worse, that you must speak to a healthcare provider and get things assessed, discussed and managed, because it is treatable, So please reach out and get help if you are struggling. Until next time, see you soon.